So, good morning, viewers. So, today is World No Tobacco Day, 31st May 2021, and the theme is Commit to Quit. So, there is very close correlation of tobacco, nicotine use, and severity of the COVID-19. This pandemic has led to millions of tobacco users saying that they want to quit. Commit to quit today and sign the pledge. So there's a link for the pledge. So anybody can just go to that link, WHO link, and they can pledge to quit. So quitting tobacco is no easy fate. So you are brave and courageous for committing to this goal. Remember to set a quit date. Giving yourself a short period to quit will keep you focused and motivated to achieve your goal. And you can start quitting today. Tell your friends, family, and co-workers they can support you and encourage you to not give it to temptations like cravings. So anticipate challenges, and it is important that you anticipate triggers and challenges in the upcoming attempt, particularly during the critical first few weeks. Remove tobacco products from your environment, and it is important to minimize exposure to the cues. So I'm Dr. Rakesh Gupta. I'm the anchor of the show. I'm President and Director of Public Health Strategic Institute for Public Health Education and Research, SIPHER. And I'm a former Director of Health Services and Director of Chemical Examiner Lab, Punjab. Dear viewers, we welcome you all to this very special edition of SIPHER Health News Channel. And it coincides with the World No Tobacco Day. So it is my proud privilege to welcome Professor Dr. Pratima Murthy from National Institute of Mental Health and Neurosciences, Bangalore, NIMHANS, for an informal talk for this special edition of SIPHER Health News, being released on the occasion of World No Tobacco Day. She is Professor and Head Department of Psychiatry and former Head Center for Addiction Medicine, NIMHANS. She is a clinician, trainer, and a researcher, primarily in addiction and mental health. She has edited several manuals on addiction treatment and management and has been an international trainer for the WHO, for UNODC and ILO in tobacco, alcohol, and other drug cessation. She is involved in clinical as well as cessation and quitline initiatives for tobacco, virtual training through the ECO, as well as postgraduate training and research in these areas. She also works in forensic psychiatry, human rights of the mentally ill, and documentation of the history of psychiatry. So we welcome you, Dr. Pratima.
Thank you. Thank you, Dr. Rakesh.
So she has more than 40 awards to her credit, and Dr. Pratima has been bestowed with more than 14, as I said, 14 different awards. And she's a recipient of the Government of Karnataka Raja Ramana Award for Science and Service to the Society. She is an international associate of the Royal College of Psychiatrists, UK, and she is member of the NIMHANS delegation to Washington University at St. Louis. It was in March 2010. And International Harm Reduction Association International Conference on Harm Reduction, Bangkok. She attended in April 2009. And in Malaysia, she was nominated by the National Commission for Women to attend an international conference on women and family. And it was way back in September 98. So the research highlights are that Dr. Pratima Murthy, she has published about 250 articles and more than 30 books or monographs. And she has presented her research work in national and international conference and delivered more than 120 invited lectures and presentations. Her research works are mainly focused on alcohol and drug abuse, tobacco use, and mental illness. She has co-authored the NIMHANS Guidelines for Delivery of the Mental Health Healthcare Services during the COVID-19, 2019, which is a very, important and the current topic. She is the principal author of the Government of India Standard Treatment Guidelines on Substance Use Disorders and Addiction, and a co-author on National Treatment Guidelines for the Tobacco Cessation. So complicated alcohol withdrawal and unintended consequence of COVID-19 lockdown 2020. This is also very important these days. Climate change and mental health, World Health Organization, Regional Health Forum, it was in 2008. Then decentralized multi-site BBM analysis during adolescence shows structural changes linked to age, body mass index, and smoking. So this analysis was presented very recently. family member involvement in relapse prevention improves alcohol dependence outcomes. A prospective study at an addiction treatment facility in India, Journal of Studies on Alcohol and Drugs in 2010. So we welcome you, ma'am, and I don't think there can be more appropriate person for this World No Tobacco Day function than you. So we'd like to know about your medical college days, MBBS and MD.
Thank you very much, Dr. Rakesh, for asking me. You're taking me back in memory, talking about my MBBS and MD. I'm an alumnus of the Bangalore Medical College. And I think it was fascinating for me because I was the first doctor in the family. So I think it was very exciting for myself as well as my family that I got into medicine. You know, I worked in both the very well-known Victoria Hospital in Bangalore and Bowring Hospital. And right through my college days, I think I always had a fascination for medicine and the working of the mind, you know, in relationship to medicine. We have a very, very strong BMC 79 batch. And, you know, we connect, I think in the era of WhatsApp, it's been wonderful to connect up and actually see how many of us as undergraduates have kind of gone into so many different specialties. Some of the classmates are IAS officers. And, you know, it's amazing the kind of you know, specialties that we all cover. And I think I'm the only one who actually went into psychiatry. And I think it was a bit serendipitous because I was really exploring all I certainly knew I didn't want to do surgery. I wanted to do medicine. And within the broad area of medicine, I was looking at all the various specialties. And I happened to get into psychiatry at the National Institute of Mental Health and Neurosciences. At that time, I think in undergraduate medical education, there wasn't much of an emphasis in psychiatry. The only time, you know, you had a couple of lecture classes, and then you spent perhaps a week or two during your internship. You never really got a feel of it. I thought, okay, let me try out psychiatry. I'll see if I like it, you know, and then give it 3 months. I came into NIMHANS and I never looked back. I think it is both the discipline of psychiatry as well as the institution where I studied it. Both of them were very, very remarkable influences. The field of psychiatry, because I think it offers a huge opportunity to look at the way people think, feel, and behave. And it ties in beautifully with a lot of the practice of medicine that requires to be done in an effective manner. So I think that's what kind of had me stay here. And of course, doing a training in the Premier Institute in India was another bonus, and I've never looked back since.
So excellent, ma'am. And you have actually taken me back to my medical college days. So mine was the 1977 batch. And as you said, we are also well connected, about 100 people.
Okay.
So, but those were real nice, good days. No?
Absolutely.
And it is good that you chose psychiatry because not many people actually chose those days. And it is gain for India, I must say, rather for the international community. Yeah. So thank you. And ma'am, I'll like to ask you about the correlation between tobacco, nicotine, and COVID-19. About nicotine, I'm telling you because the e-cigarettes, the popularity of the e-cigarettes amongst the youngsters, though these are banned in India, but still they are available online. Yeah.
So let me start off with talking about tobacco use and COVID. I mean, it's not as if we did not know the harms of tobacco use before. We already knew it. And we were already encouraging people to kind of, you know, give up tobacco. But I think it's become very, very important now to give up tobacco and all forms of tobacco. And, you know, first of all, we know that smoking affects the lungs primarily. And we know that COVID also primarily affects the lungs and, you know, the respiratory system. And when smoking already weakens the lung, the risk of COVID infection may be more. Also, we know that smokers are likely to touch their mouths, their hands, and other surfaces, which is likely to increase the risk to COVID infection. And, you know, sharing of any form of tobacco, especially smoking and hookahs, etc., can also spread the infection to others. And we also know smoking reduces the immunity, and therefore the ability to fight infection is reduced, making the person more vulnerable. And more importantly, we also know that it complicates the outcomes in people who already have COVID, possibly a greater propensity to the cytokine storm, which is why people are now saying that one of the reasons for younger people, to develop COVID-19 is possibly some of the lifestyle related issues. And of course, we know that smoking causes a variety of non-communicable diseases, diabetes, cancer, etc. And that kind of complicates the recovery from COVID infection. Similarly, smokeless tobacco also has risks, just as with smoking, people constantly spitting, touching their mouths, likely to spread the infection. And we also know that chewing causes a lot of lesions in the mouth, which again can increase the risk. And the side effects of smoking and chewing on various organs of the body can also occur, both from tobacco use as well as from COVID itself. So I think it's a double whammy and people have to be very careful. The good thing in some ways is that COVID is an opportunity for people to quit.
Yeah, you're right.
The other question you asked me is about shifting to electronic cigarettes. Yeah. So like you said, it's banned in India, so we don't have to face that problem. But we know from other parts of the world, emerging concerns about the risks from vaping and the use of electronic cigarettes. People not very certain whether it's the tobacco that is there or other psychoactive substances that people may be using, but certainly the risks of electronic cigarettes are very well known. So the advice now is not really to shift to electronic cigarette as a way of harm reduction.
Yeah. So you're right, ma'am. And I think now people are actually serious about it. The governments are serious about it because in last 1 year, so many states, they have banned the spitting and banned tobacco products for some time, but now I think they are easily available. But still, I think the persons now, the citizens are well aware about the harms.
You mentioned about the theme of this year's World No Tobacco Day as commitment to quit. One of the things that we've noticed in the tobacco quit line that we run, although the number of calls have reduced, the number of people interested in quitting, that too because of health reasons, has increased. And possibly their commitment to quit has definitely increased. So that's, I think, a very positive note for this year's theme.
Yeah, so COVID has been positive on this issue at least.
At least on one issue, yeah.
So, ma'am, what other initiatives you have initiated, for tobacco cessation? So you talked about cessation. So what else?
So, first of all, I must say, I think since the early 90s, that is 1992, 93, is when the first tobacco cessation clinics in India started. And it was very, in some way historical that since then, we've been involved in not only setting up our own tobacco cessation facilities, but actually training people in different parts of the country to set up tobacco cessation facilities, train doctors, other healthcare professionals in providing this. We've also, as you mentioned, the M cessation, developing content for the M cessation, where you just give a missed call to the National Health Portal M cessation website, and you actually get messages sent to people on the importance of quitting, the risks of tobacco use, and steps on how to quit, setting a quit date, dealing with craving, getting support, dealing with withdrawal symptoms, checking on mood when they follow up, and so on. So that's something that carries on for almost a year after the person registers. Then we've also initiated the National Tobacco Quitline. It started off in the Vallabhbhai Patel Chest Institute, and now there are 4 regional quit lines. Apart from that, in NIMHANS, in the Tata Memorial Institute, as well as in Guwahati. And it's fascinating how young counselors can be trained in providing, very timely advice to people who call in and encouraging them to quit and getting them to quit. So it's amazing in terms of a public health output. Finally, I want to mention that we've been using the digital platform very extensively. The NIMHANS ECHO collaborative project. We've been training several dentists all over the country through the IDA independently, several other health professionals, tobacco counselors who work in NCDs in tobacco cessation. So it's been fascinating to actually develop it. With all this, of course, I have a regretful a word of regret, that despite efforts, still tobacco cessation has not taken off adequately. We recently did a paper a couple of months ago looking at the services in Bangalore. at many of the hospitals and other health facilities, it's still not very, very well established as a routine part of healthcare. And I think that's where we need to go in the years ahead.
I think the issue is that physicians, maybe they are too busy and they don't refer the cases. That may be one of the reasons in hospitals. But it is very encouraging, I mean, the people coming directly to you, approaching you through Cessation and telehealth lines. Because recently, as I told you, we are having a teleconsultation for COVID, mild cases, basically only for the isolated ones, the home isolated ones. And we are getting very encouraging, I mean, feedback from patients. So those teleconsultations are really helpful, I must say. And ma'am, will you tell us, is the cessation for SLT different from smoking tobacco?
The broad approaches are much the same. But one of the differences between smoked forms of tobacco and smokeless forms of tobacco is that in smoked forms, there are very rapid rises and falls in your blood nicotine levels. And therefore, craving and so on is much higher among smokers. And therefore, is a greater challenge. With smokeless tobacco, you get a more uniform, thing. So the craving is not as much as with smoking. But the challenge with smokeless tobacco is the social acceptance, and therefore, people believing that it's okay to use smokeless tobacco. In terms of the pharmacotherapy, of course, you might need much lower levels of NRT, for example, for smokeless tobacco treatments. Smokeless tobacco chewers are more difficult to engage, but once you've engaged them, possibly the outcomes are better. We were talking about healthcare professionals. I think we all know that brief intervention by a physician is a very powerful tool. So even if a physician is busy, just 2 to 3 minutes of encouraging the person to quit and offering support to quit is very important. And for both smoking and smokeless forms of tobacco, psychosocial counseling, they're very, very similar. So, there are similarities and there are differences.
I'd like you to tell us more about electronic cigarette, because in National Health Services in UK, now it is being used very commonly. I mean, they're propagating it, in fact. So what do we say about it?
Yeah. So, I mean, I think when addiction is concerned, we all realize that harm minimization is one approach. So, for example, when you actually prescribe a form of nicotine through nicotine gums, patches, lozenges, inhalers, etc., what you're doing is taking out the 7,000 chemicals, the 70 carcinogens that are present in the tobacco, in smoking tobacco, as well as other forms of tobacco, away, and giving the person pure nicotine, which you would gradually taper and reduce. Now, the problem with electronic cigarette is that the safety-related aspects has not been sine qua non established, and therefore it may not be wise to recommend it as a thing. It is also, I mean, there are reports that young people can start off with using it as a nicotine delivery tool, and that's another challenge. And I think countries are facing the problem with Juuls and so on. So one problem reduces, the other increases. So that's why it may not be a very...
And the issue of dual usage is definitely...
Absolutely.
And moreover, I think in many states in India especially, it has been declared as a poison. The nicotine has been declared a poison.
Yeah. So, I think people have been looking at ways of reducing supply of tobacco. Which is a challenge to all of us. You can't keep on reducing only the demand for tobacco. You also have to restrict supply, and that is a big challenge for all countries.
So
but
that
gradually,
means that, the already available, products, the FDA approved products should be used.
Yeah.
So
for example, Gutka has been banned in practically all the states of the country. But when there is a demand, it is either sold as separately as as the pan masala and the tobacco, or it still continues to be used. So I think looking at both supply and demand related issues become very important in a country which has so many different tobacco products.
You're right, ma'am. So, ma'am, and what will be your message for our young clinicians and the public health professionals?
Okay. My message is, be an advocate for tobacco control, which means you need to encourage people not to use tobacco. You need to denormalize tobacco use in society. Be an advocate who tells people, who warns people about the dangers of tobacco use, and that is we all know about the Empower, which is a comprehensive policy for tobacco control. In that, 2 of the health strategies lie with you and me. One is the W, warning people about the dangers of tobacco smoke, and O, which is the offering people help to quit. And this year's theme, when people are committed to quit, and the GATS tells us that almost 55% of smokers and about 50% of tobacco chewers want to give up. But the thing is, globally as well as in India, even though people want, they all know that it is harmful. They don't want to be spending money on something that's harmful, but they're unable to give it up because tobacco contains nicotine, which is a very highly addictive psychoactive substance. So they try a couple of times, they don't have a positive experience, they give up. So far, what we just would do is tell them, okay, it's harmful to your health, give it up. But we wouldn't take them through the support process to actually quit. Now we have enough evidence to say that with psychosocial support, brief intervention, the 5 A's model, which is ask, advise, assess, readiness to quit, assist in the quit attempt, and arrange to have the person maybe go to a specialized clinic if it doesn't work, is a very effective tool that every physician, even the busiest physician, can use in their clinical practice. So please be an advocate and advocate tobacco cessation, to prevent tobacco use, and support people in their quit attempts. They'll be extremely grateful to us because it really saves a lifetime of disease, both communicable as well as non-communicable disease, saves money for their families in terms of reduced healthcare costs, and of course, makes them much better, much better in society because there are no harms from second and third-hand smoking either.
So thank you, ma'am. And I think it was the apt message for the young clinicians and public health specialists. So thanks a lot.
And Dr. Rakesh, I also want to tell them that think of a career in psychiatry. It's amazing.
Yeah.
It's really a wonderful, wonderful place to be.
In fact, now people, they are going for psychiatry, especially the girls. I feel that they are now attracted to this specialization.
I don't think, in fact, we have a very good gender balance right now. I head the Department of Psychiatry, so it's very nice to see a lot more women coming. But I think, yes, as you said, I think people are attracted to anything that integrates. And now we don't talk about physical health and mental health so different from each other. We talk about integrating physical and mental health. We talk about looking at lifestyle risks for all diseases. And tobacco, alcohol, psychoactive substances are preventable risk factors for a host of disorders. So I'm sure the young physicians will come, will be training at a time where all these are looked at together. And I think that's the advantage they have, which makes it all the more exciting for them.
You're right, ma'am. And I think this counseling part we have been doing all throughout life. I'm an ophthalmologist, but I know that with counseling alone, we can, promote this cessation of tobacco. So physicians have
to be excellent communicators.
Yeah,
just as
you're right, ma'am. Yeah. So thanks, ma'am, for sparing your time. And I know you're a busy person. So you spend almost 40 minutes with us. That's so the great honor for us. So thanks a lot.
Thank you, Dr. Rakesh, for having me. Thank you.
Thank you. So thank you all viewers. And now we'll have some health news from Doc Plexus. So thank you all. Thank you.
Hello and welcome to Health Minute Highlight. A novel study conducted by Chinese researchers from Hunan University revealed that SARS-CoV-2 encodes several viral molecules known as circular RNAs. Some of these molecules have the potential to trigger cellular and genetic reactions that may cause cancer. Doctors from Patna Medical College and Hospital's Microbiology Department have reported white fungus in 4 patients, including 2 patients who had recovered from COVID-19. The doctors have warned that the white fungal infection caused by Candida and Aspergillus can be as fatal as the black fungal infection. A renowned biopharmaceutical company has received approval for pegcetacoplan from the US FDA as the first and the only targeted C3 therapy to treat paroxysmal nocturnal hemoglobinuria in adults and in patients switching from C5 inhibitors therapy. The increased use of antibiotics to treat COVID-19 infection in India is further fueling drug-resistant infections. According to a study conducted on more than 17,000 COVID-19 patients, 3.6% to 28% of patients developed multi-drug resistant secondary infections, with almost 60% of them succumbing to them. How can the judicial use of antibiotics be ensured during the pandemic? Let us know by commenting below. Health Minute, the most liked segment of Docplexes, brings you the latest happenings in the medical field. Stay tuned for more insights. Happy Docplexing!